Joining me live right now, as I mentioned, is Dr. Joe Concini, Akron Children's Hospital Sports Medicine Center. Dr. Joe, good morning, my friend. What's on your mind this morning?
Hey, Ray, what's on the mind of so many people talking sports and asking me questions about sports medicine is what does this mean now with a rotator cuff contusion? So it was clarified a little bit in our quarterback's shoulder, Deshaun Watson, that it was a shoulder contusion, means a deep, deep bruise. Now it's being called a rotator cuff contusion. Certainly hope there's no structural damage to the rotator cuff because that could be a lot longer period of time out. But I'm going to introduce this space to you called the subacromial space. So sorry to use a lot of medical words, but your audience is so good at knowing this. The subacromial space is all the way out to the end of the shoulder, the point of the shoulder. There is a bone off of the shoulder blade called the acromion, and that forms the roof of this space. And then the round ball, the humerus, forms the floor of this space, and it's a couple inches wide. And there's a couple rotator cuff tendons, a biceps tendon, a big bursal sac in that spot, and people injure it when they fall on it, when they land on it, when they get hit on top of the shoulder, a helmet especially in football, right at the point of the shoulder. And what can happen, of course, is swelling, bruising, bleeding. And what ends up happening later on, as we get into our age range of adulthood, is there can be arthritis in it. Some young athletes can have arthritis that narrow that space. But if that space with bruising and swelling is narrowed, people cannot lift their arm fully. And so what happens is, for somebody who'd be like a throwing athlete, it would be very difficult to play their sport. You might be able to get by your sport if you were in a different position, but in a throwing position, it would be difficult. Versus our friends that are in our age range who get to a point they have trouble throwing a ball overhand or even serving overhand, totally straight overhand because they can't get their shoulder up high enough because the subacromial space gets arthritis in it later on. But usually in young athletes, it's swollen, bruised, and it can be in the bursa or the tendons. They've mentioned it's in the rotator cuff. And, of course, unfortunately, part of it is time and rest and ice, and treatments of physical therapy can reduce that swelling, and sometimes injections into that space. We don't know if any of those things have been done with Deshaun Watson, but all we know is he's still having trouble with that space, is getting the arm above his head. You know, one thing that it makes me think of is if you think, this is an old fan reference for you and I, you think about the days of those big shoulder pads that athletes and football players used to wear. There was a big round pad right on the end of the shoulder pads that protected this space. Well, no more. I mean, what are the pads now? A half the size of what they used to be, Ray?
Yeah.
I mean, I just think of, I don't know why, I see that image of Kevin Mack with those great big shoulder pads, and that's not that long ago. And now they wear very small shoulder pads. They wear no knee pads. They wear almost no thigh pad. And so what's the reason for having small shoulder pads, Ray? What do you think is the reason for these athletes to want to make them smaller and smaller?
Well, mobility to throw and catch, I imagine.
Exactly. So for speed and the lower, they don't want anything heavy on them, like a heavier shoulder pad. So for speed and especially mobility, a lot of people would maybe not recognize that, but you're an astute guy. Definitely improving mobility, and though they're giving up the risk of injuries, especially injuries like this, bad contusions, when those pads have gotten so small. So, maybe that's the reason why, as we get into older age ranges, if this narrows out, some people even need shoulder replacements in our age range, shoulder surgery for that space. And then maybe that's why people are moving to pickleball more than tennis, where you have to be straight overhead. But the point of the matter is we don't know the specifics of how well they're doing getting rid of some of that bruising and swelling and narrowing in the subacromial space, and I guess we'll all find out on Sunday.
Joe, it's been, about a week and a half or so since the diagnosis, and he couldn't play. And I know you're not in the medical room and everything, but cases like this, best case scenario, maybe he gets out there this weekend or not. Worst case scenario, could this guy be done for the year or not?
Well, this is exactly why I said that one of the first sentences is, of course, the way it is, because people don't want to give out injury information at the pro level, the college level, or the high school level. I'm not going to say anything about any of our high school kids either. Everybody's very vague with their terminology. They're calling it now rotator cuff contusion. Last week it was just a contusion or bruise. But as I said, if there's actual damage in the rotator cuff, like tearing in the rotator cuff, a lot of it may also be in the bursal sac. The bursa really swells a lot, and they're just maybe having trouble controlling that. But if they get into structural injury to the rotator cuff, of course, then things become a lot longer period of time off, and that would be the biggest fear. But we have to go by what we hear, and they say still that it is a contusion to the rotator cuff without structural damage.
All right, Joe, great information, my friend. You're right on it and keeping us updated of what you can. We appreciate it, my friend. Thank you.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's